Hello, everybody. My name is Asid. I am the founder of Decibel Entertainment, and I am a music producer and based out of Surrey, British Columbia. I am joined by three very smart people who are working very hard to deal with the pandemic that we have right now. And the purpose of this video is to get some information for our community so that we can get access to some accurate information that we need in this time, especially with a big part of the summer around the corner and big events coming up, and also practices that we can incorporate into our everyday routines to help limit the exposure of people that we are around. And so in order to do that, we're joined by three doctors who are all in the Lower Mainland. I'm going to let them introduce themselves in a minute here. And after that, we'll get into some questions that we have received from members of the community, from clients who have booked us for their big events that are coming up, and just in general information that even I would like to know for my family's health and so forth. So starting with interview, if you could please introduce yourself, and then we'll go to Bear and stuff from there.
So thanks for having me. I'm Dr. Birinder Narang. I was born, trained, did all my medical school and residency in Winnipeg, and right now I work in Vancouver. I work at a few different places, Vancouver General Hospital. I've worked a few times at the urgent primary care centers, and I also have a small practice in Vancouver as well.
Thanks for joining us.
I'm Dr. Sukdevan. I work at Surrey Memorial Hospital as an emergency physician.
Thanks for joining us, Suk.
I'm Dr. Birinder Narang. I work with Inderby in Vancouver. I also work in Burnaby in urgent primary care, long-term care, and I'm the vice chair of the Burnaby division of family practice.
Thank you for joining us, Birinder, as well. So we'll get right into this, and we'll start with some of the very basic information. So, Inderby, maybe you can start by answering this one. What is the coronavirus, and how does it differ from the COVID-19?
Sure. So the new or the novel coronavirus is a virus we haven't had exposed to the human immune system before. The actual virus itself is known as SARS coronavirus 19, and then the actual disease it causes is COVID-19. And so there's the virus itself, and then there's the disease it causes. And the reason we're concerned about it is because it's very new to our system.
And how does the COVID-19 differ from like regular flu or cold?
The difference between the cold, influenza, which is our flu, is that our human systems have been exposed to it before. We have a vaccine that comes out every year for the flu, and so we've created a degree of immunity that protects the average person, but then also protects our immunocompromised, our elderly, maybe people who aren't able to get the vaccine or more predisposed to complications. And we right now don't have that for COVID-19, and we also don't have a treatment. So for influenza, we treat people with Tamiflu. Right now, we don't have those options.
Thank you. And what are some symptoms of COVID-19 that people should be aware of?
So I'll defer that to Dr. Narang, because he's doing quite a bit of testing and swabbing and triaging at the urgent care centers.
Yeah, so essentially we're looking for three main symptoms when we're asking patients or triaging them, and keeping in mind that there is a lot of variability in presentations, but based on some current data we have, 65 to 80% of people are going to present with a cough, 45% of people will have a fever, 85% of people won't. 45% of people will have a fever on presentation of illness, but then 85% of those won't have a fever for the rest of it. So it's not like it's going to be a sustained fever. And 20 to 40% of people will have shortness of breath. 15% of symptoms people might have symptoms such as what you'd expect with a cold, like runny nose, sore throat, and stuff like that. And they're saying even up to 10% of people might present with just gastrointestinal symptoms.
So that leads into another question that we have, which is, if somebody has symptoms, do they need to get tested? If I have symptoms, what do I do? What does my family do?
I'll take that one too, just because things are changing. And I think what is underlying this, and we're going to get to this in a bit, that this is dynamic. So as this is a new virus that lots of people don't have exposure to, don't have experience with, that means we need to really rely on the institutions we have on place for updated information. And that is changing literally on a daily basis at this point. So I can give you information that we've gotten from yesterday. Dr. Henry, who's everyone's probably seen on TV, who's the Chief Medical Officer for British Columbia, and Adrian Dixor, who's our Minister for Health. We're discussing yesterday how there's going to be a change in strategy to testing. So let's say you, for example, you said you come down for symptoms. Last week we might have asked you, where have you traveled from? At this point, we know there's enough cases here that asking where you traveled from probably isn't going to differentiate whether I think you need to be tested or not. So it really depends on the severity of your symptoms. If you have, like, let's say the upper respiratory symptoms, like a sore throat and a mild fever, you've had this 100 times before, you're young, you're healthy, you can rely on your immune system. The risk of you coming to a clinic to get tested or emergency or wherever you are is probably putting you at higher risk of actually picking up the virus than actually the test being useful for anything. Like, the test isn't going to change how I treat you. So my advice to you would be stay at home. And right now they're saying for at least 7 days, but that is probably going to change based on the data that we get. So right now, last week they would tell you to stay home for 14 days. Now they're saying at least 7 days. And then keeping in mind that that could change, and we'll talk in a few minutes where to get information from, but we would tell you, once your symptoms have abated, like your symptoms are all completely gone, give yourself another 2 to 3 days at least after that before you re-enter the community. Because even though you might not be symptomatic right now, you're still at risk of passing on the symptoms, whether it's the coronavirus or one of the other viruses, which might present as a coronavirus to the community. Because as an individual, you're responsible to yourself, but you're also responsible to those around you.
Right. Yeah, I think that's a really big point. We'll get into that. So here at the ER, what are we seeing in countries like Italy and China that is concerning our healthcare systems here in Canada?
Well, the big thing is the severity of the illness that's coming in with people that actually do have coronavirus. So in Italy, about 16% of patients require admission to ICU, which is a huge amount of resource utilization. So this is the big concern. And I know, talking to our ICU colleagues, they've been conferring, and they're actively involved in increasing more capacity of ICU beds. So it leads to the important point of trying to contain this virus and decrease its spread. If you look at countries like Singapore and South Korea, they have been able to flatten the curve, and they've been able to reverse the exponential growth of this virus, which is extremely important, because otherwise there are some terrible stories coming out of Italy about not having any ICU beds for patients. The number one thing, if you get severe illness with this virus, is the ability to access an acute care ICU bed with a ventilator, which is going to help you get better. That's the most important thing that will help. So if everyone gets this virus at the same time, or within a few weeks, or within a month, our system will be strained and will collapse and not be able to deal with that.
Right. So that makes a lot of sense why there are restrictions about public gatherings and social distancing. And one of the questions that we've been asked a lot is about some explanation about what it means to practice social distancing. So, well, if you guys could just shed a little bit of light on that. What does social distancing mean in this case, and why is it important right now?
Sure. So social distancing means changing our behaviors relative to the norm. So we're saying minimize your social interactions to things that are essential. So if you need to visit a family member, please do that. But otherwise, don't go out into large gatherings. If you are, maintain 6 feet apart. And we want people to really focus on the essentials, so grocery shopping, going to the pharmacy, and really limiting their interaction with other people, so we can, as Dr. Birinder said, flatten the curve, reduce the number of new cases over a really short period of time.
Flatten the curve is a term both of you have used. If you could explain what that means and how also, second part of that question is, what can we do to stop the spread of the coronavirus, and what does flattening the curve mean?
So those two questions are really linked together. So when we talk about flattening the curve, if you can imagine, if you have a really big spike in new cases, say 10,000 new cases in a week versus 10,000 cases over 6 months, you can see how you can treat 10,000 patients a lot better with a lot more resources over 6 months versus 2 weeks. So when we talk about flattening the curve, we basically want to take that peak away and we want to just plateau it and stretch it out as far as we possibly can. The best way to flatten that curve, there's a really good Washington Post simulator that shows how flattening the curve works, is social distancing. The measures China uses is quarantining people. That's not really consistent with how our government works. We don't anticipate that to be happening. So we're really, really, really relying on people to actively participate in social distancing to help flatten that curve.
So I know this has also impacted you on a personal level. Of course, it has impacted all three of you on a professional level. But if you could just shed some light on how it's impacted you both, obviously professionally and personally, and then we'll get into talking about the events from there. Sorry, that's for Dr. Mahal.
Sure. So I'll let the other two talk on the professional part, and I'll touch on the personal part. My wedding was in approximately 7 to 8 weeks, so May 1st. And so that means myself, my family, my partner's family, we will be rescheduling our wedding. We actually had a guest list of approximately 250 people. But if you really look at the guidelines of what those 250 people events require, it's social distancing, keeping 6 feet apart, wiping shared surfaces regularly, and we can ensure that if you really look at what a wedding is, lots of handshaking, lots of hugs, lots of time spent on the dance floor in close proximity. And so for us, it would be irresponsible for us to hold our wedding and also put our family and friends at risk. So it's been really challenging, but it is something that needs to be done.
Right. And Dr. Narang and Dr. Tim, on a professional level, I imagine it's been very hectic the last few weeks for you guys.
I'll go next. Professionally, as with Indivir and Birinder, we're on the front line along with our nursing staff, housekeeping staff, and there's a lot of stress and there's worry among family members that we might become ill. There's physician capacity, nursing capacity that's lost because they have to go home and self-isolate for symptoms, so it increases a workload burden on the remainder of the staff. So it's very challenging to deal with. The other thing, I personally have a family member affected with COVID-19 who is intubated and sick. So I'm seeing that time course of the illness play out in real life. And it's a very challenging situation to deal with. This virus has a very rocky up and down road. It looks one day like things are getting better, and then it can completely turn the next day, and the next day it looks better. And so it's a very difficult course. I'm also going to have to unfortunately leave the chat because I've got to go visit my family member now as well. So I'd love to participate further, but I'm going to have to leave at this point.
I appreciate that. Thank you so much for your time and for your contribution.
Thank you.
So let's get into, of course, like for South Asian culture, there's a lot of big events associated to all facets of our life, whether it be religious, whether it be weddings, whether it be any kind of celebration. You have Vaisakhi, you have gatherings at mosques, at mandirs, and so forth. What do we need to do different in the South Asian community to minimize our risk?
Well, I think that Dr. Mahal has already mentioned two of the most important factors, and I think we should take an opportunity right now just to discuss, when we say hand washing, like there's a proper way to hand wash and then an improper way to hand wash, and we can all get a bit complacent with that because it's very easy to be like, "Yeah, I've been washing my hands every day of my life. I know how to wash my hands." But we're talking about really scrubbing it down. And if you need appropriate information, I think we're going to come to that in a second, where to get reliable information, because we do live in an age of misinformation today. So that's important. But you really want to be rubbing your hands together with soap for at least 20 seconds. So that's really key. So 20 seconds is important. There are a lot of videos and information pages online that we can get to. So once we get to the resources section, we'll go into that. But when you're washing your hands, you want to be doing it like way more than you're used to doing it if you're in a social situation. And then we want to look at other surfaces too, because viruses don't necessarily live on your hands. Your hand is also touching your phone, it's touching your clothes, it's touching the tables, your computer, your keyboard. So these are all potential vectors of transmission, doorknobs. So these are really important. And, you know, we're all on our phones so much that we, you know, it's very easy to forget these things. But if you wash your hands and you touch something that's dirty, you're potentially reinfecting yourself, or reintroducing the virus to that area of body. And then that won't make you sick itself, but it's more when you're touching the mucus, what we call the mucous membrane. So those are like points of entry of the body, your eyes, your nose, your mouth. And that's where the virus can get absorbed into those membranes. And that's when it can affect you. And that's not unique to this virus. That's just in normal infectious disease precaution. So when you look at that, you look at potential vectors of information, you look at of transmission, you look at the social distancing part. The impact on the community is like how Dr. Mahal already said, which was, we are a very social community to begin with. We do celebrate things. A lot of our gatherings, you know, a 250-person gathering might be fairly routine for some of the families here. And 250 number, I think like that's a number that could very well change in the future. And we're seeing that even when we're looking at what's happening in Europe right now. You look at Italy, the number of cases that have jumped in the last 24 hours, I think it was almost 4,000 new cases in 24 hours. And the countries of Spain and France yesterday have basically put on a much wider kind of social distancing blanket, where they've asked, you know, restaurants and most public spaces, cafes, movie theaters, everything that essentially closed. And we're seeing it like Apple has closed all of its stores outside of China right now. Lululemon is closing its stores. So these are the big companies which are seeing the severity of what's happening. And I feel that it's important for our community to recognize that these are big corporations with potentially billions of dollars to lose, and they would not do this lightly. So if that's like, you know, if that correlates to how you interpret severity, it's important to know that if these guys are doing that. So we all need to look at what's important in our lives. And it really comes down to the basics. If there is an event that you've been invited to, you really need to question yourself right now. Do I need to be there? And you also have to anticipate, with the number of cases that are coming, this is going to get worse. And that's what all the data is showing us right now, that it's getting worse. And the virus has been affecting people a little differently, even from China to Italy. We're seeing younger people with more severe illness in Italy. And we don't know where the virus is coming into Vancouver. Obviously, we're a multicultural society. People are coming in from everywhere. And so all we can do is you know, prepare for the worst, and that's where all these things are important. And you see on one end the severity of cases that Dr. Demon and his colleagues see in the emergency. So if you have mild symptoms, like going to the emergency is just putting you and your family at increased risk.
Dr. Mahal, would you like to add to that?
I have to really echo what Dr. Narang said. So you'll hear each of the public health officers use the term, these are exceptional times, which they are, and that means we need to exceptionally modify our behaviors. If you look at Italy, a lot of the Easter masses will be live streamed. We do not have anybody going in for individual prayers. And that means our own Sikh, Hindu, Islamic, South Asian community also has to adapt. This is hopefully something that is not, you know, going to be extended for a long term. We can control it for a short period of time, but we need everybody on board. And you know, Italian culture is very social, Indian culture is very social, but we really need to be careful and really look at the risk when we're going into a large gathering. And my recommendation is, if you have been invited to a large gathering, you really take the time to recognize the risk that you have for yourself. If you get the virus, you bring that home, and your grandparents are home. We know 20% mortality in people over the age of 80, and that's the data out of Italy. But we're also seeing a lot of really critically ill patients in Seattle, in France, under the age of 50 who are healthy with no underlying comorbidities. So this is not an issue just for the elderly and the sick. This is something that impacts all of us. And I have never seen a time where someone else's action so closely influences my health and your health. So really, really, we need to be careful in evaluating our social and cultural and religious practices.
It really is a matter of looking out for everybody with your actions, isn't it? Your actions very directly affect basically anyone that is in your network. And if you are, for whatever reason, still practicing nonchalantness towards the instructions that you've been given by the health officials, then you really are deliberately putting people at risk that you interact with.
Absolutely.
And one other part that's related to this is you don't necessarily know, like you might have a large circle of friends who you know quite well, but you don't know what chronic illnesses people are dealing with. You don't know what's on their face. You don't know how your behavior might affect them. And so the last thing you'd want to do is potentially contribute to harm to someone you know and care for.
Right.
And saying that there's a lot of anxiety with what's happening right now, and it's reasonable to be anxious. These are uncertain times, but there is reliable information coming out. I think, within reason, that our government is actually providing us a lot of information on a regular basis, whereas in countries like China, they didn't have that luxury. So we do have informed advice and recommendations, and there's a lot of mistrust of institutions in the world today. But what if they're telling you to stay at home? They understand the impact of that, and that we should respect that right now. And we do need to look at our own kind of stress relieving techniques in this time too.
Right.
And I don't know if Dr. Mahal has some good suggestions for that, but we can all work on that right now, because if we sit on our phones looking at updates in this kind of world of notifications after basically your phone blowing up all day, you will contribute to a worsening of your own mental health.
Completely. I think we really need to strike a fine balance between being, and we talked about this before, being cautious and
Right.
modifying our behavior, but not falling into that spectrum of, lots of fear, lots of anxiety, not sleeping at night. We need to channel that anxiety, shift it towards changing our behaviors. And if that means, you're basically at home for the next 7, 10, 14 days, read a couple books, watch Netflix. Everybody has, list of things they want to do, learn to cook, financial investments, whatever your niches you've been wanting to explore. Take that time, do it now. My dad made a great joke. He said, "This is better than Christmas. You get to spend time with your family." And I completely agree. And so we don't want to make people panic, but we do want to make them aware of how important every individual decision is in managing this.
Thank you. And lastly, both of you said this, that there's a lot of information out there that can be misleading. What are some sources that both of you recommend where we can get more accurate information that can be shared within the community that you guys are aware of?
Sure. I've been looking a lot at the BC CDC website. There's a lot of information for health professionals and patients. So if you've been asked to self-isolate or you're a traveler, there's information and handouts there that you can share with your friends and your family. The World Health Organization is a great source, as is your local urgent care center or a family physician who's been up to date on COVID-19. And so my only recommendation is to not read everything believe everything you read on Facebook. Really go to those trusted organizations that are working hard.
And locally, actually our health authorities, I guess most of us are in the Lower Mainland right now. So Fraser Health has a great general public question page. Everyone has access to their medical health officer updates. and same as Vancouver Coastal. So what I can do is I can share those links with you, Asad, and maybe when you put this up, you can just share those. And yeah, like I agree completely with what Dr. Mahal said. You know, and if you want to look at some US stuff too, the Mayo Clinic and Cleveland Clinic tend to have really reliable and information that can be useful.
Awesome. Thank you so much to both of you for taking the time out, especially right now. I know you're both probably swamped and super busy with, given the circumstances. I wanted to make sure we took just this time to create some information for the community, especially with the outreach we have on social media. I think it can help. And I just want to thank Dr. Mahal for the idea and coming forward. And I really appreciate the fact that you guys are shedding light on it also, not just from a doctor's point of view, but also from within our community, given the fact that we do like to have a lot of bigger events. And right now, you know, we're dealing with a lot of people who are obviously upset that their events are having to either be cut down or postponed. And, you know, it's really important to remember that this isn't about clients and vendors. This is about, you know, humans and versus a pandemic, and we're all on the same side here. So I really appreciate you guys taking the time out to do this.
Of course.
Yeah, thanks for having us.
Yeah, thank you so much.